At 4ZZZ, we acknowledge the traditional owners of the land on which we broadcast. We pay our respects to the elders past, present and emerging of the Turrbal and Jagera people. We acknowledge that their sovereignty over this land was never ceded.
And we stand in solidarity with them.
You're listening to Transmission on 4ZZZ, amplifying the trans and gender non-conforming voices of Brisbane and beyond.
Hello, you're listening to Transmission on 4ZZZ. My name is Ez, I use he, him pronouns. I've got a guest.
My name is Ellen, I use they or she pronouns.
Woo! How you doing, Ellen?
Pretty good. I'm stoked to be back in the studio. I've missed Zed.
Yeah, you haven't been on in a while, have you?
No.
Yeah.
It's such a great place.
Where would people recognise your voice from?
I was doing the Megahertz show for a bit.
Yeah.
A bit being like 3 years. And I filled in here and there, you know. Zed is a big community and we all play our little roles.
Yeah, I'm so glad you're here, and we're going to be having some cool chats today about PrEP and sexual health, which is important for the trans community. If you're tuning in and you haven't heard this show before, it's Transmission. We're all about amplifying the voices of the trans community and beyond. So every voice that you hear in this hour of trans power is trans voices from within Mianjin or around the country or around the world even. We talk to lots of different people about lots of different things, whether it's their careers, representing their story, or we're talking about educational things that affect the trans community. And if you're not trans yourself and you're listening, welcome to the world of things that affects trans people and the things that we discuss and talk about. So yeah, I hope you get to learn adjacently as we inform our community. So
beautiful.
Woo! We're going to start with some week in community events and news. I've got some news out of Scotland. Scotland has paused prescribing the puberty blockers to under 18s. So Scotland's only gender identity clinic will no longer be able to provide puberty blockers to new patients under the age of 18. Glasgow's Sandyford Clinic is the only available specialist sexual health service where trans and non-binary folk can be referred to via GP referrals or through self-referral appointments. The action follows the recommendations outlined in the Cass Review, an independent investigation led by Dr. Hilary Cass into the available healthcare for trans and non-binary youth and children experiencing gender dysphoria or those questioning their gender in England and Wales. Puberty blockers are medication which temporarily and reversibly halt the progression of puberty, helping offset the stress for those dealing with gender dysphoria and questioning their gender identity. Following the Cass Review, published on the 10th of April, Trans Plus youth charity Mermaids shared a statement responding to the report's findings and suggested actions regarding gender-affirming care. To quote here, "We are concerned that some of the language in the report is open to misinterpretation and could be used to justify additional barriers to accessing care for some trans young people in the same way the interim report has been," the Mermaid statement reads. Speaking to BBC Radio Scotland, First Minister of Scotland Hamaz Youssef has said there is not a case for Scotland to close the Sandyford Clinic in response to the finding of the Cass Review. We will be talking about the Cass Review on Transmission. There will be an episode about that coming up. There's a lot to unpack, so we're doing our due diligence and doing all the research we can to make sure we inform you, dear listener, on how it affects you as a trans person, how it might affect your friends if you're an ally, and what we need to do to look out for each other and how we can prevent further damage to our medical care. So, yeah, it's not just affecting Scotland, it's affecting everywhere. And unfortunately, our government pays too much attention to things they shouldn't. So, anyway, there's also, I got a message this morning from the wonderful Heidi LeFay. If you don't know Heidi, she works making wigs and things for trans people. And yeah, so she's actually doing a community crowdfund at the moment where you can donate to local trans community members to access the joy of human hair wig, alleviating dysphoria due to hair loss or alopecia. So I'm going to pop a link up on the Transmission Facebook page at Trans Radio with a Z. That's on the Instagram as well. It's all the social media there. There's an account that you can donate to. So, you know, people who are suffering from alopecia and just want some beautiful long hair, you know, donating some money means that Heidi can buy all the materials needed to then make the wigs and customize it to that human. So if you could, please donate to this crowdfund. It will help our community immensely. So I'm just going to put that up on the socials. Even if you just donate like $5, $10, $15, anything is good and goes towards making someone's life better. We would greatly appreciate that. Yeah. Amplifying the voices of the trans and gender non-conforming community of Meanjin, Brisbane and beyond.
Transmission on 4ZZZ brings you the latest in trans community news, music and events.
Every Tuesday from 9am till 10am.
Join our team of hosts for an hour of celebrating the unique perspectives of the trans community.
Transmission, Tuesday mornings from 9am till 10am on 4ZZZ. You're listening to Transmission on 4ZZZ. My name is Ez. I use he, him pronouns.
My name is Ellen. I use they, them or she pronouns.
Ellen, what are we chatting about?
Well, there's some research going on that I think is important and may be relevant to our dear beloved listeners. So what we're wanting to look at is young people's understandings of HIV and their understandings of things that they can do to protect themselves from it, which can take many different forms. The listener may or may not know that different kinds of sex have different sort of risks for the transmission of HIV. And we all know that trans people particularly have difficulty accessing education that's relevant to them and accessing healthcare that's relevant to them and can be affirming and safe. So we want to find out barriers around them accessing those things with the view to hopefully one day be able to dismantle those barriers.
Yeah, and then have really fun and exciting sex safely.
Yeah.
Yeah.
That's the dream.
That's it. Yeah. Would you like to discuss a little bit about HIV and how PrEP works? How would you... Yeah?
Sure.
Yeah?
So I'm going to assume that most people are probably familiar with HIV. It stands for Human Immunodeficiency Virus, and it's the cause of the AIDS epidemic right through the 80s and 90s, which obviously disproportionately affected queer communities. And it is still around today. It doesn't typically cause AIDS anymore in Australia. That's very uncommon because HIV is very easily managed. So if you just take your medication, your treatment, the virus can be fully suppressed and then that person can live a long, healthy, happy life, and it's impossible for them to pass it on to others. So thankfully, it's a very manageable chronic health condition these days, but the less chronic health conditions you can accumulate, the better. So HIV, it is not able to be transmitted with oral sex. It's very difficult to transmit with vaginal or front hole sex. It's mostly through anal sex and other sort of blood sharing activities that it can be transmitted. And obviously that kind of sex, anyone can have it. Anybody can be having those. It's not really based in your gender identity, right? So there has been a misconception, I think, typically that HIV is something that only affects cis gay men. We know that that's not true. We also know that in Australia, trans women particularly are overrepresented in new diagnoses. And increasingly amongst younger generations, that's also true of other sort of gender diverse and non-binary communities. So we want to know how to better be able to provide them with healthcare and things that can prevent them from getting HIV, because a lot of that marketing hasn't been aimed at them, and a lot of healthcare professionals might not understand that this particular person is still at risk, even though they are not a cis gay man. So yeah, PrEP is one way. So PrEP stands for pre-exposure prophylaxis. It's a medication that you can take either every day or in an event-based way, although that's not suitable for everybody. And then you're totally protected. You can't get HIV if you were taking PrEP.
There's also PEP, right?
Yeah.
So how does that one work?
So PEP is a post-exposure, so that's like an emergency time-sensitive medication. So a really crude analogy that I would give is think of PrEP like a contraceptive pill, and PEP is the morning after Plan B pill. So if something happened and, you were not on PrEP, maybe a condom broke, maybe you had a wild night, whatever it is, you're now worried about it, you could access PEP from a hospital or a specialist clinic. You need to start it within 72 hours. You take it for a whole month, but it'll protect you retroactively so that if you were exposed, you're not as likely to become HIV positive.
Wow, this is cool.
Yeah.
I mean, back in, the 90s and early noughties, this was not an option, so it's really cool.
It was not. And the reality is that people should be able to enjoy their lives, and just telling everyone to use a condom all the time isn't really actually practical advice.
Yes. Well, also, it's not always, for people who have been in relationships for long periods of time as well, and maybe are not like sexually active with more than one other partner, having the option to be able to be like, hey, look, how we know that we have regular sexual health checks, we're looking out for each other, and we're communicating effectively on our sexual activity, but I want to have, like someone might be like, I don't want to have sex with this particular way, but PrEP is an option to still stay safe, then you have that option, which is really nice.
And I think that's the thing, is it's really important for everybody to know what their options are and to be educated about the risks and their potential options. It's not about telling people you should do this or you should do that. It's just about empowering them with the knowledge and access.
It's interesting that you were saying how, the marketing's not quite reaching the trans community. And I think since you said that just before, I was like, oh, you know what? You're so right, because I go to my GP and I see him. He's a cis gay man. He's lovely. Absolutely adore him. And I don't really I've only ever been offered by him PrEP. It's like, hey, have you thought about this as an option? And I've been like, wow. I mean, I just thought that was something for cis gays.
Yeah.
I forgot that's, that actually is a broader part of the whole LGBTQI plus community that actually need access to this. So it's really cool that we're having this discussion.
Absolutely. Yeah.
There's also a little chat you have with, what was her name?
Her name is Sarah Warzywoda. So she's the lead researcher on this. So the big takeaway for anyone listening is, if you like talking about this stuff, if you like thinking about this stuff, or maybe even if you've never thought about this stuff before, if you are aged between 16 and 24, regardless of your gender identity, regardless of your sexual orientation, you can do a little survey online and you go in the draw to win $50. Or if you did an interview, you will be guaranteed to get $50 for that hour of your time.
I'm going to pop that link up on the Transmission socials as well, at Trans Radio with a Z, and you can scan the QR code if you're interested in an interview or doing a survey. We recommend it. It's for ages 16 to 24. Is that right?
Yes.
Yeah, perfect. Sweet. And we're now going to jump into a little interview that Ellen had with Sarah. So yeah, let's do it.
Sarah Warzywoda is a PhD candidate and research assistant at UQ, and she's heading the iPrep UQ study looking at the attitudes of young people towards HIV prevention. Welcome, Sarah.
Thank you for having me, Ellen.
Thank you. So can you tell me a bit about what this study is looking at?
Yeah, so we developed the iPrep UQ study to help us build an understanding of young people's sexual practices and behaviours in terms of HIV prevention. So there are HIV awareness and awareness of HIV prevention methods.
Awesome. And so what does the study involve?
Yep. So what we're doing at the moment is we have 2 phases that we're recruiting young people for. We have a survey of young people across Queensland for anyone who's aged 16 to 24. This is looking at sexual practices and HIV prevention among young people across Queensland generally. Then we also have a set of interviews that are focusing more on priority populations who are at risk of HIV. So we're doing some interviews to help understand the specific barriers and facilitators that can help influence access to healthcare, sexual healthcare, and HIV prevention.
So what are these priority populations? So what kinds of youth are you wanting to chat to?
Yeah, so for our interviews, we are looking at priority populations that have been identified in Australian notification data. So at the moment, what we're looking to talk to young people who identify as gay, bisexual, or men who are having sex with men. And we're also looking to chat to young trans and gender diverse young people. And this is based on the notification rates we're seeing in Australia. There HIV risk is higher among men who are having sex with men. So that's why we're focusing on that particular population. But we also want to chat to young trans and gender diverse people because we know that there's a higher risk of HIV transmission among certain populations of trans people, but also we know that there's additional barriers that trans youth face in terms of access to healthcare and awareness of certain healthcare available to them. And they're under-researched a lot within the community. So we want to have a really good understanding of what trans young people understand and need as well.
I totally agree that there are a lot of barriers in place for trans people to access healthcare, and those barriers can be different to those faced by the wider queer community.
Absolutely.
Definitely need more data that's trans-specific sort of research.
Yeah, and we've found that there is a very big interest from young trans people to be involved and to have a voice within research. So we found it really important to make sure that we are including them in a meaningful way in the research that we're conducting.
And why trans and LGBTI young people in particular?
So with notification data in Queensland, there are trends that you can see in HIV risk, and that seems to increase with age. So what we want to understand is access for young people. Do they know about these sort of, HIV prevention medications? Are they aware of prevention medications called PrEP and things like that? And how we can improve awareness in young people to help them mitigate risk factors that can be presented sort of as they age. So we really want to understand what's happening with young people and how we can help facilitate and improve access and awareness.
Beautiful. And what might this research study or the implications of being able to gather that data do for the community?
Yeah, it'll help us understand what young people currently know about HIV prevention, and are they accessing things? Are they seeking healthcare? Do they know whether or not they have a potential risk? So it's really going to help us understand what's happening with young people and what are the factors that are creating the barriers in accessing this information and healthcare. So that's going to give us a really good understanding of what's happening with young people. And what we're hoping to do with that is help to inform better models of care, access and education that are tailored towards the needs of young people. So what we want is, instead of having, a bunch of 35-year-old, 50-year-old older people sitting there telling young people what it is that they need, we want the young people to tell us what they know and what they need.
So if there are people listening to this who are age 16 to 24, and particularly those in that age bracket who are trans and gender diverse or gay, bisexual, and otherwise queer, how can they get involved if they would like to help contribute to research that might ultimately help improve access?
Absolutely. So we have a website that we've developed, which is hosted by the University of Queensland. So that's public-health.uq.edu.au/iprepuq. So that will take you to our homepage, which allows you to access the interviews and the survey. So you can do both if you like, or you can do one or the other. It's totally up to you. And from there, you can also contact myself if you have further questions about the research. So my name is listed at the bottom along with my contact information.
Beautiful. And just for the listener, iPrepUQ is spelled IPREPYOUQ. And are there any sort of incentives for people to be participating in the study? Are people going to be reimbursed for their time?
Absolutely. So we understand that, particularly for the interviews, you are taking time out of your day. So for the interviews, we are offering a $50 voucher for everybody who takes part in our interviews. And for the surveys, there is a chance to go into the draw for one of 16 $50 gift vouchers. So those are online gift vouchers that you can use across a range of different services and products.
Awesome. Thank you so much for your time, Sarah.
Thank you very much for having me.
Woo! Yes. All this sexy talk about taking care of our sexual health, isn't that so sexy and great? Thanks, Ellen, for having that wonderful interview there about...
Thanks, Ez.
Yeah, iPrep. So good, so good.
Hey listener, did you get the memo? It's April Atonement, a month-long opportunity to make amends for lapsed subscriptions and to go in the draw to win prizes from some of our friends. New Farm Cinemas, Big Fork Theatre, Felons, Jets Fitness, Brisbane Festival, Woods Music, Oracle Tattoo, Vent Space, 4000 Records, and Art from the Margins. Become a subscriber this April Atonement. Head to 4zzz.org.au now.
My name is Ez. I use he, him pronouns.
My name is Ellen. I use they or she.
Woo! And you're tuned into Transmission on 4ZZZ, where we're talking about PrEP and sexual health and getting educated and all sorts of things. This is all very exciting here this morning. And Ellen and I were just chatting as the music was playing about some interesting stats on who's getting, who currently in the community out there is percentage-wise getting or having testing positive for HIV. So interesting. Yeah, do you want? Let's talk about that.
Yes.
Yeah, let's talk about it.
Yeah, I mean, in Australia, we really have failed First Nations people, obviously, across the board on a lot of health outcomes. You look at the Closing the Gap 10-year report that recently came out, and we have really failed to meet a lot of the things that we set out 10 years ago to achieve, and HIV is no different. So it's estimated that about 10% of undiagnosed HIV in Australia is in First Nations communities, particularly in sort of rural and remote areas, and we see this with syphilis as well. It's just a lack of access to care, and I mean, probably quite a lot of different failures there. The other thing to consider is things like PrEP are not affordable necessarily for people who don't have Medicare. So people who, particularly men who are having sex with men who don't have Medicare, is another big population.
And so there's data there that's harder to gather as well, I would assume.
Yeah.
Mm.
I mean, I can't remember off the top of my head the sources of all of these. There's lots of different reports that have come out. But a big chunk of undiagnosed HIV in Australia is presumed to be in particular populations of men who are having sex with men who were not born in Australia and who, may not well be eligible for Medicare now. It is still possible, I want to say, for anyone who's listening who's thinking about maybe PrEP would be suitable for me. It's totally possible to get PrEP quite affordably without Medicare. You can go to pan.org.au, PAN, which stands for PrEP Access Now. There's lots of information there about how to get it. Any of the state-run sexual health clinics will see you totally for free, and you can get your script there. Then you can order it online. The cheapest way to do that is to import it, which is legal with a prescription. But HIV treatment is free for everybody in Queensland, regardless of if you've got Medicare or not, but I don't think that's true for all other states. It might be true for Victoria. Yeah, but what we are seeing is that, like, the queer community, particularly amongst cis, gay and bisexual men, have just responded so well to this after the legacy and the huge trauma that was the AIDS pandemic, that we new cases in those populations are fewer as a proportion of undiagnosed cases. So it is increasingly more of a heterosexual problem than it has been in the past. And I don't mean that there are heaps more numbers, but just as a percentage of cases that are new or that haven't been diagnosed.
Because we were talking about how, if you're having anal sex with a flesh penis, unprotected, then you are at risk.
That's the risk. Yeah,
that's the risk. It doesn't matter your sexuality, how you identify. It's just the pee in anus without protection. That's your cause. Yeah, that's your potential cause.
Correct.
And high risk.
Yeah. Other sex acts, you don't really need to be as worried. That's the one.
That's the one.
Yeah. But anyone can be having that, right? We know anyone can be having that kind of sex.
Yes. It just, predominantly and, culturally and assumed that it has mostly been within cis gay communities, which it has been historically. That doesn't mean that, just because you're not in that community, doesn't mean it doesn't affect you. We're all people, all intersections of lots of things. And just because you yourself may not be having anal sex with a flesh penis, you could also be sleeping with a partner who is. Yeah. And so then that can put you at risk as well. So it's, this is a community effort to look after our health, and we got to do that together. So, yeah.
Absolutely.
Interesting stuff. Looks like we're pretty much come to the end of transition.
Thanks
this morning.
so much to having me on and having these little chats. I could talk about this stuff all day.
Yeah, I know. You work in a clinic where you do this all the time. So it's nice to have a professional in here talking about all this sort of stuff. And look after yourselves out there. Make sure you take PrEP where you need to, take PEP when you think you need to, and also, put a helmet on, be safe.
If you want to.
Yeah,
if you don't want to, that's all right too.
Just communicate that.
Yeah, obviously you've got to have a chat about it. But testing for other stuff is important too. Syphilis is on the rise. There's plenty of other STIs out there there. So just get checked. Nothing to catastrophize about. Enjoy your life.
Yes, and stay vigilant. Also, I would like to just give a quick shout out because I've had lots of subscriber lights flashing in the studio.
We had flashy time. I'm so thrilled about that.
Yeah,
Big
so
thank
good.
you.
Thank you to Kev from Brighton and Caitlin from Greenslopes for subscribing and keeping 4ZZZ on air during this April Atonement. Woo! We've only got literally today to subscribe.
Wow, the last day.
So it's your last chance to get in.
Some hot prizes.
It's true. If you're a Transmission fan, subscribe so we can stay on air and we can keep bringing you news and events and community updates from the trans community. The only way to do that is to look after 4ZZZ, which is our station that we're on. So yeah, do that. Head over to 4ZZZ.org.au/support. Win prizes. There's so many to choose from, genuinely so many. You get golden tickets. You've got
I'm just hanging out
retro
to see if I've
screenings,
won.
Felons Brewing Co., art from the Margins Gallery as well. You get a micro gallery set up. You could also get a year membership at Jets in Fortitude Valley. There's so many things. Check it out.
It's the last day.
Yeah.
I love Zed.
Yeah, me too. I also love Zed. So yeah, thank you so much for tuning in to Transmission today, and see you next week. So bye.
Bye.
Thank you so much for listening to Transmission. See you next Tuesday, 9 to 10 a.m. on 4ZZZ.